I'm Dr. Angie Stoehr, and this is Feminine Curiosities. One issue that I see fairly often in my office as a sexual function specialist is burning during sex. So I'm going to tackle that today and see if we can't figure out some of the things that can cause burning during penetrative intercourse. There's actually quite a few things that can be considered as potential causes. I would say the most common thing that causes burning during penetrative sex is actually just a good old garden variety yeast infection. Yeast infections are pretty common in young women. There's an offset of the pH, which then causes yeast to grow. This isn't the kind of yeast that you put in bread. It's specifically Candidiasis or Candida albicans for the most part. There are other strains of yeast, but it's the most common. And it causes typically kind of a thicky, chunky white discharge, occasionally just a really profuse liquidy discharge, and a sensation of burning or itching around the vagina, the vulvar area, up inside the vagina. And obviously, when you've got a really pissed off vagina like that, it doesn't feel very good to put something in there, whether that's a toy, a finger, a penis, doesn't really matter. So if it's a new onset, gosh, I don't know what this is, and you're having some discharge, you might want to get checked for a yeast infection. Other causes of burning with sexual intercourse is typically what we would call provoked vulvodynia or vestibulodynia. Very fancy term for it touches, it hurts. So vestibulodynia is when the vestibule or the entryway of the vagina hurts with touch. So provoked vestibulodynia, just fancy term. That can be instigated initially by a yeast infection, actually, but it can be associated with any number of other things. I've seen this kind of weird pain with touch happen after childbirth, whether or not there was a tear, although more commonly in patients who had a tear. I've seen it happen after a hysterectomy. I've seen it perk up around the time of menopause. I've actually had several patients that developed this shortly after having an unusual life change, like changing jobs, or one woman had it in the process of divorce and persisted thereafter with future partners. So why would these weird kind of life changes cause an issue? To be completely honest, we're not really sure, but we do know that that entryway tissue from the vagina going to the outside of the vulva is kind of unique, shall we say. I like to say that the entryway of the vagina is kind of like where the inside of your mouth becomes the outside of your face and you've got your lips in the middle there. The entryway of the vagina kind of has lips where the tissue kind of changes from one type to another, from like face tissue to inside of your mouth tissue. Inside of the vagina is one type of tissue, and the entryway of the vagina to the outside of the vulva becomes a different tissue. And anywhere that you have kind of changing types of cells, they tend to be more susceptible to problems, shall we say. They usually replicate more quickly. The cells, as they're becoming one versus another, they turn over more fast. That's why your lips tend to get chapped more commonly than, say, the outside of your face. Entryway of the vagina, kind of same sort of deal. Anywhere where there's rapidly replicating cells becomes a happy site for the immune system to maybe do things it shouldn't. When cells replicate more quickly, they tend to make more mistakes, shall we? Which is why things like getting dry happens more frequently. So at the entryway of the vagina, if you make it unhappy with, say, a yeast infection or a vaginal tear, it's possible that that instigates the immune system to start more or less attacking the cells at the entryway of the vagina. When it does that, it sets up this really big inflammatory response where the entryway of the vagina becomes unhappy. And there are ways that we can look for that on exam. Now, that skin condition has a very fancy name. It's called vulvar vestibulitis. Again, we talked about the vestibule. The vestibule is the entryway of the vagina, and itis just means that it's inflamed. it's irritated. So vulvar vestibulitis is just an inflamed entryway of the vagina. The way we look for that on exam is we do a very specific test called a Q-tip test or a cotton swab test. And we touch the entryway of the vagina very carefully and look for specific responses, including pain and redness and irritation, etc. Now, in the process of that skin being irritated, it also often creates another problem where when it hurts, the vagina tends to kind of cinch up in response. That's normal. I always tell my patients, when you hit your thumb with a hammer, you don't go, oh, shoot, that hurt, right? You grab it with the other hand. It's because your body's natural reaction to pain is to clench. So at the entryway of the vagina, if it hurts on touch, your vagina is going to cinch up. That in and of itself can cause pain. And sometimes that's actually what's causing the burning and not necessarily the skin condition. That cinching up of the vagina can be in response to pain. It can also be just a natural response to stress in some people. And sometimes we don't know exactly why somebody's vagina is really tight. It can be from something from childhood. It can be just something that was developed over time based on religious beliefs or what have you. And stretching a tight muscle can also cause burning. Now, there's many other issues that can cause burning with penetrative intercourse, including bladder issues like bladder pain syndrome, also known as interstitial cystitis. It can be muscle issues further up inside the vagina. It can be things like your uterus or ovaries. Those I'm going to tackle in a different lecture. So in this case, entryway pain with penetrative sex, most commonly a yeast infection and the vulvar vestibulitis, that irritation at the entryway of the vagina, or the muscles being too tight. So if you're having a burning sensation or an uncomfortable sensation with initial penetration during sexual intercourse, those are the three most common things to be looking for. And those are things that most of your gynecologists should be able to go poking around and finding. And if they can't, see if you can't find yourself a sexual dysfunction specialist. If you guys would like to ask any questions, please do send me a message down below, hit like, send me to all of your friends.